Great, we're going to go ahead and start the webinar. Right, good afternoon, everybody. Thank you so much for joining the Impact Stakeholder Committee meeting. We're going to give folks just a couple of seconds to log into Zoom. I can see the attendee numbers continuing to climb. Thank you, Nancy. A couple of quick reminders about meeting logistics. We are continuing to meet via webinar, Zoom platform. It is available by telephone and on your smartphone, tablet, or computer. American Sign Language interpreting and closed captioning is available. To enable closed captions, please select the live transcript icon on your Zoom toolbar. And meeting slides, video recordings, and transcripts are all posted to the California Health and Human Services Master Plan for Aging webpage. We are saving time for public comment, so those who are joining us are welcome to either raise their hand to join the queue, or if you're joining by phone, that the key is *9, and that will add you to the queue. For additional public comments or for meeting feedback, you can always email engage@aging.ca.gov. And with that, I will pass it over to Director Susan Torres.
Thank you, Maria. Good afternoon and welcome back to all of our Impact Committee members and to anyone joining us by Zoom or phone today. Thank you for being here with us. I wanted to start just briefly by sharing, and I think we're going to share the agenda next. Yep, there we go. So here's how we're going to spend our next 2 hours together. In terms of the agenda, we are so excited that we took receipt of the committee's report, one-year report on the Master Plan for Aging. And this represents a huge milestone for all of us because it's the first full feedback loop that we have with the Master Plan for Aging. And we're very excited that this loop will continue for years to come. So thank you for your tremendous work on that. We're really looking forward to hearing you break it down for everyone who's joining today. And when I also want to thank the Impact Committee members for their part in shaping today's agenda. We co-created this and we see reflected on our agenda some of the items that were reflected in the committee report. So we will be hearing from Jillian Rice with RSE. So that will touch a little bit on the need for more attention and awareness on the issues of the master plan and our aging population. And we also will be, as noted in the committee report, we're now in the 3rd year of our pandemic. And today we wanted to remind everyone who is part of this committee and listening in to continue to use their networks. We need to enlist your support to help magnify the continuing messages about vaccines, boosters, testing, and treatment for the 50+ population and anyone who's immunocompromised or at higher risk of COVID, that we still have continued concerns and you're key in communicating those messages for us. The report also touched on 2 big issues that you'd like to see us focus on in coming years. So we'll be hearing from Dr. Sarita Mahantni, and I will talk a little bit about a September 20th convening. And then this group was originally charged with a key role in oversight, accountability, transparency, and equity for the master plan. So we'll hear from Sarah Steenhausen on a few data and research updates that reinforce your role insofar as oversight, accountability, and transparency. So that's it for our agenda today. We'll go ahead and move to the members of this committee. We don't take an official roll call, but I want to thank every one of you who's joining us today, and to let you know that a couple of our members did have great excuses for not being here today. It is spring break for many people around the state, so we understand Kevin Prindeville is not here, and I don't yet see Doug Moore joining us, but I hope that Doug can join us. And I think Sharon Nevins gets extra credit because she is on vacation and is joining us from her vacation. Sharon, welcome.
Yes, hi.
Hi there. And before we go to the presentation, which will be the primary focus of our meeting today, where we'll hear from stakeholder committee members, I wanted to welcome Kim McCoy-Wade, the Senior Advisor to Governor Newsom on Aging, Disability, and Alzheimer's. Kim is with us today and wanted to make some opening remarks. Welcome, Kim.
Thank you, Susan. Thank you, Kim, and thank you to the whole group. I'm so pleased to be here, as you say, Susan, as we hit an important milestone of our first, well, maybe our second full feedback loop, our first one on the plan development and our second one, but our first one on implementation. I wanted to just say it is an exciting time to see so much work rolling out. Yes, CDA continues to lead the charge with the network on getting the word out about keeping current with your vaccinations. And so thanks for the great event we had this month at an adult day health center. We're due to vaccinations. Not only are people staying healthy and safe, but are also reconnecting at our adult day health, senior centers, all of the spaces that are so important to come together. But it's really much more than that. This is tax season. And so we're reminded once again to get the word out that California is the only place where older adults can claim the earned income tax credit. And even though tax day has passed, it's never too late to file when you're owed. So we hope you continue to spread the word and we can increase the thousands of older Californians who benefit from that state tax benefit. And then history will be made on May 1st, when California offers Medi-Cal health insurance to older adults over 50, regardless of immigration status. And how important is that, not only for clinical health, but also for all these important connections to home care and community care that we know in the aging and disability space are the key to healthy and happy aging. So it's really an exciting time to see the momentum built. And really, I'll just share a message that Susan and I shared at the cabinet work group that convened this week. Gosh, it's been a long week, but within the past few days to talk about all the progress. And we really had two messages. One was, I likened this to kind of the third quarter of a basketball game, if you will. We were coming off March Madness. And this is really the third quarter of our 2-year cycle to implement those initiatives, and asked everyone to really focus on finishing strong with the 140 initiatives that we had laid out. There's still time. There's still time in this year's budget cycle. There's still time with bills that are pending. There's still time with administrative actions to really finish strong on that and to make sure we run through the tape. If I can mix sports metaphors, sorry. But the other important thing that we're doing, and Susan's leading us in doing, and I'm so grateful for, is looking ahead. How do we want to organize and implement the work for the next 2 to 4 years to be determined? And your report really is so exciting to see, both in how it looks back and looks forward. And so I'm really excited to be here and hear the report and part of that discussion as we think together, as we co-create together what the next phase of Master Plan for Aging and California leadership and partnership looks like. So great to be here amid a lot of spring flowers, a lot of hopeful things happening, and look forward to planting even more seeds with you all today. Thanks.
Thank you so much, Kim. So glad you can be here. And for those who don't know, Darcy Delgado is also joining us from the California Health and Human Services Agency. Welcome, Darcy. And with that, we will go ahead and turn the agenda over to Dr. Fernando Torres Gill.
Thank you, Susan, and thank you, Kevin. I hope you can all hear me well. And thank you to everyone in state government, certainly the governor's office, the California Department on Aging, and all the many state agencies and commissions and boards that are working with us to move forward with our master planning on aging. And this is for us an exciting time, a milestone of sorts. It's our really, I think, our full first report from the Impact Committee, which has been charged with ensuring that there's momentum, there's oversight, there's accountability, and that there's kind of an independent voice that's looking and observing and working with, but also prodding our great state government as we work towards implementing the many recommendations of the Master Plan on Aging. The report which we have submitted to, I believe, the State Department on Aging, and you now have advanced look, is divided into two sections. The first, the many accomplishments, the themes, the key issues that come out of our first work. And the second part, which we also want to spend time on, is our view towards what would be the critical key high-level recommendations that we want to really make an impact in the next 2 years for older persons, persons with disability, all of us that are aging with the disability. So we try to keep this report both coherent, brief, but to the point, and hopefully it will serve as a roadmap for how all of us can work together. The Impact Committee, those that are on the various master plan subcommittees, as well as state government. And in that regard, I'll moderate our portion of today's agenda. And I'd like to first call on Sarita, and then followed by Michael and Elizabeth, to talk about that first section of our report addressing issues of leadership, investment, the role of the local level, as well as the issues of coordinating the many things that have come out of the master plan. So I see Sarita, so I'm going to turn it over to her.
Great. Thank you so much, Fernando. And thank you, everyone. Hope everybody's having a great afternoon. And, I get the opportunity to really highlight some really important work that has happened during the year one of the implementation of the master plan. First of all, I'd like to highlight some of the key leadership and stakeholder committees that are in place. And, the governor and his administration really followed through on some important commitments, I would say, to really identify leadership and build these committees to ensure that we do have an implementation that is effective for the master plan for aging. So some of the actions that I'll describe really prove to all of us the state's commitment to responding to aging, responding to disability issues, and really offers this foundation and structure that we really hope to see for effective implementation of the plan. So one, and we have had the fortunate opportunity to see some of the leadership in action. In October of 2021, we saw the appointment of Kim McCoy-Wade as Senior Advisor on Aging, Disability, and Alzheimer's, and of course Susan DeMorris as a now not so new, maybe, Director of the California Department of Aging, who are both inspiring and have done tremendous work. And we've also seen some real important hires in the California Health and Human Services, Department of Healthcare Services, Department of Social Services. So really you see this buildup of expertise, real expertise in aging and disability, and you're seeing their voices and their actions as we move forward. And the Impact Committee has also been very impressed by the state's creation and launch of a number of MPA, or Master Plan for Aging, committees. We saw the implementation of this committee, which we really appreciate, and I feel very honored to be on the Impact Committee, the Disability and Aging Community Living Advisory, or DACLAC, and Equity and Aging Advisory Committee, and the California Elder and Disability Justice Coordinating Council. So, again, a lot of work has been brought forth in the master plan. I would say some of the things that we've highlighted as recommendations moving forward is, really improved coordination kind of among and across the various new committees, the ones that I outlined and that are also noted in the report. And also think, we'd like to see, and I think maybe some clarification on what are the goals, objectives, purpose of committees. And I think that would just strengthen the effectiveness of how we really build stakeholder engagement. And also in the coming years, we really feel we should be provided maybe again about feedback loops and what across these different committees, what are the complementary kind of actions and responses? And, there might actually also be, I think for us, some recommendations about additional committees for consideration focused on housing and transportation. And because these areas are, rising to the top and are critical areas on the master plan. So that's the first piece that I thought on behalf of the Impact Committee, I wanted to highlight. And again, some really positive feedback and some recommendations. The second piece that I've been asked to speak on is about the, just to highlight some of the historic investments in older adults and people with disability. And again, a very important accomplishment. In 2021, we saw the governor and legislature pass a historic 2021-2022 state budget that included investments for all 5 goals of the master plan. And this included on, across maybe 40 or more investments in aging and disability. And I know those are outlined in your report. There's also a link that goes into detail that Justice and Aging has put out in terms of the summary of the budget, but it includes things around the homelessness crisis among older adults, expanded access to Medi-Cal for older adults and people with disabilities, creating more innovative programs around all of the state's Alzheimer's prevention and preparedness task force. And the one thing that I think is also important for folks to remember is that the state, California, did a great job leveraging the increased federal funding for Homecare to develop what is described as the Home and Community-Based Services Spending Plan. And there are a lot of initiatives in this plan, and many of which align with the master plan goals. And I think in average, it estimates close to or approximately $3 billion in enhanced funding for such important and vital services. So, I think, we see that this budget and the spending plan are really highlighting some of the overdue, really important investments that for aging and disability communities, excuse me. I think the recommendations by the Impact Committee would be along this, that as we move forward, it is vital that we focus on continuing to implement these and new investments, ongoing investments in communities, really focus on communities so that older adults, people with disabilities, their families, really can witness, experience those lived changes or lived needs in their own communities. And a lot of focus again on home and community care where individuals want to see some real traction. It is also really critical that the future funding and and investments included are identified to address what I would say is the growing demand for services in aging, disability network, and care. And the master plan has, I think, a lot of opportunities to track, and we'll hear more today about some of the data and analytics to really monitor some of these investments and where we're seeing the realization of those investments. So those are some of the highlights. And with that, I will go ahead and turn it back over to Fernando. Thank you.
Miranda, you may be muted.
Sorry about that, folks. Keep forgetting about the unmute button. Anyway, thank you, Sarita. And I'd like to now ask Michael to come up to the plate and address another important aspect of our report, the role of local communities, the city and counties, and the local playbook. Michael?
Thank you, Fernando. Thank you, everyone. It's good to be here. An important reference in the MPA is the age-friendly communities. And I want to give a little bit of context about the network and where we've been as a state in this, including the state joining, as we know from the report. The World Health Organization created this important framework of age-friendly communities in 2012. AARP became the official US affiliate in 2012, and we're proud to be celebrating the 10th anniversary of that. Nationally, there are 652 jurisdictions in the network, but here in California, when we started with 6 local jurisdictions in 2016, we're now up to 73 member jurisdictions representing nearly 24 million Californians, plus the state of California joining. It is essential for our elected officials to have a key voice and be drivers for this work. We've worked closely with mayors in San Jose, Mayor Liccardo, Mayor Libby Schaaf in Oakland, Eric Garcetti in Los Angeles, Hilda Solis in Los Angeles, one of the county supervisors, and the importance of their perspectives and how they guide jurisdictions through the process. Their commitment really is essential and required to impacting and the influence of the decisions to join the network and to make the commitment. The program is a 5-year cycle where participating jurisdictions commit to becoming age-friendly and working on what are framed as the 8 domains of livability: transportation, housing, outdoor spaces and buildings, social participation, respect and social inclusion, civic participation, employment, communications and information, and community supports and health services. All ranges of efforts that jurisdictions manage and think about for what it means for them to be able to create an environment for folks to age in their communities and for communities to support them. In addition, many jurisdictions are adding domains that are relevant to them, including emergency and disaster preparedness, dementia-friendly, and equity. When a jurisdiction becomes a member of the network, after the most senior elected official, mayor, board of supervisors, and certainly the governor for the state, sends a letter of commitment and an application. And at the local level in the first year, members conduct a needs assessment and a survey to really understand and listen to the community on what is needed, what they're experiencing, and what will inform development of this information that leads to a age-friendly action plan. And for the state, the MPA actually is the action plan. In year 3 and 5, members implement these plans at the local level. And in year 5, members of the network engage in continuous cycles of improvement. And they provide reports to ARP, where we are then able to provide additional counsel and support for them as well. We're starting to see several jurisdictions that are already completing this 5-year cycle and beginning to implement what we're calling 2.0 plans. Examples of that include the San Diego County and City of LA and LA County. We continue to provide ongoing technical assistance to ensure they've got the resources and information that is needed for this. And over the last 3 years, and we will continue to do so, we're hosting regional roundtables, focusing on issues important and outlined and addressed in this report, around missing middle housing and equity for all. Another key aspect I want to touch base on is the importance of local philanthropy, and that they can be a key partner. And a great example is in San Diego County, when the San Diego Foundation made age-friendly a priority and provided startup grants to the early adopters in that county. In 2017, states were allowed to join the network. In 2019, Bill AB 1118, which encouraged California to join the network. And we were so pleased when the state of California joined the network in 2021. This is so significant given the size of California and the example it, along with other states that have joined, are setting for local jurisdictions. Those are the key areas I really wanted to cover for the local work, Fernando. And if there's anything else, I'll turn it back to you.
Thank you, Michael, for highlighting the crucial issues and ensuring that we integrate all local governments into our work. One of the positive dilemmas, by the way, of our master plan on aging activities that the Impact Committee wants to bring out is kind of a real positive dilemma of many recommendations and how we get a handle on it. And to that end, I'd like to ask Elizabeth to speak towards that.
Thanks, Fernando, and thank you, everybody. I'm so proud to be on this Impact Committee and to highlight something today that Fernando just shared. We recognize, and Kim McCoy-Wade already said it, that there are over 130 initiatives associated with the Master Plan on Aging, which is incredible and wonderful that the Newsom administration has tackled so many initiatives over just 2 years. And yet that's what we wanted to just pause a moment and think about. For Susan and the California Department of Aging, I would take a big gulp thinking about how am I going to do that. The good news is it's kicked off a whole array of activity related to the MPA. Over the last year, we've got initiatives assigned to the California Health and Human Services Department, as well as other state agencies. We've got Business, Consumer Services, and Housing Agency involved, CalVet, the Council on Homelessness involved, the Labor and Workforce Development Agency. I mean, it's really amazing to look at all these different departments coming together. And this is what the stakeholders were calling for, is everybody, whole government getting involved in this. We wanted to just pause a moment and talk about the challenge that represents. The sheer number of initiatives, agencies, and departments involved is extremely difficult to manage. And while the California Department on Aging did a wonderful job with the first annual progress report and looking back at what's been happening, events and details of particular activities or operations, it's really hard to kind of put a finger on really what's happening in terms of action and initiatives. And so we're recognizing that being able to be clear about all of this at one time is really tricky, to say the least. So we recognize that fulfilling all of these initiatives and really understanding what is the impact on people, what is the real impact on older adults, people with Alzheimer's and dementia, older individuals living with disabilities. So we're highlighting a challenge, the communication with stakeholders regarding progress against these initiatives, and also how involved really are the different agencies, and how is that kind of coming together. So we wanted to really shine a light on the fact that having 140 initiatives is going to be tricky to see, do each and every one lead to meaningful change, have a true impact on the lives of older adults and those with disabilities. And as you're going to hear from here on out, we're going to talk about having a deeper focus on a few transformational issues. It's not to say that everything's, you know, not important. It's just to have real meaningful change. We're making a statement here that we think we need to focus on maybe a fewer initiatives to have a real deep impact. Not to say other things won't be moving forward, but that's what we wanted to kind of shift into today to talk about.
Thank you, Elizabeth. And that's a nice transition towards the second part of this report. And to try to get a handle on the many different things we're doing, we felt it was important to really hit at least a few key areas where we could demonstrate in the next 2 years and as part of the governor's first year administration, that we are making a difference. And our impact committee, we all have 100, 200 different things we all think are the most important that we would want to shed light on. But not surprisingly or amazingly, we came together and realized, you know, ultimately what would capture and give the greatest influence, impact, social change if we could really shine a lens and focus on a few key areas. And to that regard, Andy's going to speak about home care and systems of care. I'll speak towards the issues of homelessness. And then as part of this section of our report, Kieran will speak about another critical aspect. How do we continue building upon the equity and diversity that we want to ensure is in our DNA? And then lastly, Andy will come back to leadership and government's leadership. But first, our two really prizes, or our two key areas will be home care, long-term care, and I'd like to ask Andy to speak towards that, and then I'll speak towards the second one. Andy?
Yeah, thank you, Fernando, and thank you, Susan, for letting us kind of do our own independent analysis of what we wanted to do. It feels a little awkward because I feel like you could easily be on our side of this Zoom telling us what the priorities should be. But you know, I think you've heard our acknowledgement of your leadership and Kim's leadership. So we're saying this with a lot of respect and feeling like we're talking to valued colleagues. I think on the issue of home care, a lot of us feel that our country is at a tipping point on investing in home and community-based long-term services and supports. People who need support, whether they're older folks or folks with disabilities, the vast majority prefer to get that support at home. And as was discussed earlier, we have a new federal investment. We have the President of the United States talking about the need for even more of a federal investment. We have a Secretary of Health and Human Services at the federal level who came from California, who understands the need for these investments. And we have leadership in California, including the governor, Secretary Galley, and so many other leaders in state government who really want California to be a place that will be a national leader in how we support people at home when they need care at home. We know that we can't do that without a direct care workforce that is well compensated and has career ladders. And, you know, Karen is going to talk in a moment about equity. I just want to call out the equity issue that's embedded in the long-term care workforce. These are folks who are predominantly women, immigrants. There are a lot of people with disabilities who work in the long-term care workforce, and they're not in this state, given the cost of housing and the general cost of living, which have gotten worse with inflation, they're not being compensated at a level that helps them have a good life, you know, working full time, being able to, you know, afford a home of their own and be able to have a good standard of living. So really, if we can fix the direct care workforce issue, that's going to be an investment in equity for people who work in that workforce. It's also going to be an investment in equity for people who rely on that workforce to be able to live with dignity in their own homes. The other big lesson from the pandemic was congregate settings are dangerous from a public health standpoint. So if we can support people in their homes, not in congregate settings or not unnecessarily in congregate settings, it's also going to save lives and it's going to help whatever comes next in this pandemic. So we really feel there's an opportunity. Obviously, the Master Plan for Aging has 5 goals. We're not saying that they're not all important, but we think there's an opportunity to really focus on what is the next step for California over the next 2 to 3 years to make investments in the workforce, which the governor has already made as part of his budget initiative, to help create new funding streams for home and community-based long-term services and supports, including starting the ability for people to pay into a new way of paying for long-term service and supports that doesn't rely exclusively on Medicaid. And we feel like the Master Plan for Aging Stakeholder Advisory Committee laid the groundwork for this, and there's an opportunity to do something over the next 2 to 3 years to really focus on this issue. So thanks for the opportunity to lift that up, and I'll turn it back to you, Fernando.
Thank you, Andy, for highlighting one of our 2 key signature issues. And again, we feel that when the first 4-year term winds down, certainly we're all going to want to ask of the 130, 140 recommendations, what are those key signature ones that really showed we made a difference in systems of care, home and community-based care for all of us. I think will not only show we made a difference, but really transcends the many differences in our state, because all of us, you know, will ask the question, who will take care of me and who will take care of those I love? I mean, that's really what it's all about. But the second one, which has risen to not just a visceral, but a really critical social justice policy and compassion issue, of course, is the crises of homelessness and the unhoused. Interestingly enough, when we started our Master Plan on Aging 2.5 years ago, it wasn't quite at the level of all the other issues. But we know the pandemic has only exacerbated that crisis that was always there. What happens when you don't have a home, you can't afford the rent, you lose your job, you're on the streets, and certainly that is at the top of the headlines. What has not been visible as the public and the media and policymakers pour tremendous resources into issues of homelessness is a growing segment, older adults, older persons with disability. I will just add, just today in the New York Times front page article, it brought out some really sobering data that when you look at those who are unhoused and homeless and where the mortality rates are, it's primarily on those 50, 60 years of age and above. Those are the most vulnerable. Those are the ones most likely to die on the streets for a host of issues related to aging and being an older adult. So with that, we wanted to shine a spotlight on finding a way to focus more attention with the $12 billion dedicated through various public agencies and governments in California. We don't really know what segment goes to older adults. And we feel there needs to be a greater focus on that older segment. Certainly the care courts proposal by the governor, that's moving us in a good direction, but then we also worry about what is the impact? Will there be discrimination against those older persons with a disability? The main thing here is we'd like now to strongly recommend that we find a way to spotlight, to segment, to bring out and separate out the older adults in that area. And our report mentioned something that we're so proud of our governor and our state, Project Homecare. Project Homecare has shown to really work. And now I'm going to pat myself on the back. I happen to chair Step Up, which is now a national organization that actually pioneered the whole concept of Project Homecare. Rather than waiting to build a zillion housing units over the next 20, 30, 100 years, let's just buy hotels and motels, involve the private sector, use the public dollars for supportive services. And we believe we made great progress and quickly within 90 days when we buy a motel in an area, get persons off the street with supportive housing. And the governor has picked up on that and has provided tremendous new resources. But no one is telling us, how are you serving the 50 and above? No one is mandating that as we serve our population through Project Homecare, no one is mandated that you must also focus on those over a certain age because they're the most vulnerable. So we'd like to recommend that the state and California find a way to really give us those incentives, maybe even the mandates, to start looking more closely at that segment of the population, just as we have done for veterans. We believe we made a real progress in addressing homelessness among veterans. And certainly with my organization, that's one of our focus. And we've addressed we have found housing for over 25% of LA County's homeless. But that's because there's a spotlight and the VA department, the VA Veterans Administration really pushes us, incentivizes us, mandates us. So without belaboring this, that is our second signature issue, to begin to carve out and focus on the older adult segment, the older adult with disabilities, mental illness segment, and begin to give them the focus and the priority that we feel has been missing as we have addressed with many resources the larger issue of the unhoused. So I will stop there, and then all this ultimately is about equity and the many differences and how we address them in California. So to that end, I'd like to ask Kieran to step forward.
Thanks, Fernando. A pleasure to be here. I'm very grateful to be part of this committee. So I'm going to address the equity part of our recommendations, which is really an overarching framework inclusive of the two major issues that Fernando and Andy discussed as particular areas of focus. And I think it's particularly important that we think about equity in the context of the master plan and aging, because we're really also talking about intersectionality, right? We're talking about older adults who are also people of color, who are also limited English proficient, who are also immigrants, who are also LGBTQ, and are living with disabilities, right? And that those populations have historically really been left behind as we think about how to make progress in the state of California and how to advance different initiatives. So that's why we really think it's important that there be a particular spotlight. And we do want to acknowledge that, you know, throughout the stakeholder process and the development of the plan, there was a realization at a certain point that there needed to be a greater emphasis on equity. There is a section in the plan around equity, And there have been really important investments made, particularly for older adults who are immigrants in California. So expansions of health coverage, expansions of access to food benefits. And those are very important, and that we need to keep pushing in this. I think that, often we think of equity as sort of a generic term, but what we really understand about equity now is that really what gets measured gets done, and that we really need to define what we're talking about in terms of equity and what our goals are, and that we need to be specific, we need to be focused, and we need to be accountable in order to make a measurable difference and reduce disparities. And finally, that we really need to center lived experience of people in our community who have these intersecting identities.
I don't know what I'm supposed to take over again, though.
And are really able to speak to what the experience is, what the needs are, and what the best practices are. So we are recommending that there be, that equity really be elevated throughout the master plan. Right now it's half of one goal, but really thinking about it throughout the plan, specifically defining what we mean by equity, what are our goalposts, what do we hope to accomplish in certain periods of time, particularly for racial and other types of equity, and really thinking about what are the ways that we look at all of our initiatives that are in the plan, the many initiatives that Elizabeth talked about, but particularly the two that we're recommending as focus areas, and think about what are our equity specific goals, how do we really focus and target those initiatives so that they are reaching Californians who have been most marginalized historically. And then finally, that we really think about how do we incorporate greater lived experience from an equity perspective in the process, understanding that the master plan has an equity advisory committee, and that's a really good first step. And then it will be important to think about how to really charge that committee with leadership around equity, which sounds a little bit silly to say, but I think our experience has been that that committee is sort of given a broad range of things to talk about, and there could be greater focus for that committee to really take leadership, and that there could be, I think, broader and more representative membership both there, but also throughout the various stakeholder groups and the community engagement efforts, and even I know the communications efforts that we're going to talk about today around the master plan. So again, really our recommendation is to elevate equity throughout the plan, to think about ways to really embed it, and also to be specific so that we can all be accountable to advancing equity and reducing disparities. And I will give it back to Fernando.
Thank you, Karen. And our last segment is both to praise and nudge the governor in terms of his powerful potential to continue to make a difference. And to that end, I'll ask Andy.
Yeah, I mean, Susan, I think the key point here is that this master plan was created by Governor Newsom, and he's still the best messenger for why we have a plan, what's in the plan, and why it should matter to voters and to people in California. So, we just strongly encourage in whatever ways you can. And we know you've got an event coming up on September 20th, and there's other opportunities around the May revise and other things that the governor is going to be doing in the next several months, to just remind people why we developed this plan, what are the investments that we've made related to the plan, and why do they matter? Going back to Fernando's point, what does it mean for me, for my loved ones? If I need some help, if I need somebody to take care of me, who's going to be there to do that? Who's thinking about that? What are some of the holes in our current, services and supports, and what's our plan to fill those holes? So I know you know all of this, but we just wanted to put another plug that we want Governor Newsom's brand to stay on this, and for him to use his bully pulpit to really make sure these issues are front and center, especially given the size of the population in California.
Thank you, Andy. And just to close out, I think we've stayed within the time frame. I just have one last editorial. I have a number of my baby boomer friends and family that have done the classic, I'll sell my home for $1 zillion and move to places like Arizona and Idaho and Texas, and no state taxes. They can do what they want and they'll be rich for the rest of their lives. But as they now start getting older and are facing this set of vicissitude of issues, whether it's about broken hip or it's a stroke or they need home care or long-term care, they are calling me to say, I cannot find that in Texas. I cannot find that in Arizona. I cannot find home care workers in Idaho. And of course, I tried to be very diplomatic and tell them, I told you so. Maybe we're expensive, have high taxes, but we have a robust and expanding social safety net as we age with whatever disabilities we have. So this is just, I think, a golden opportunity, certainly by the governor, by the impact committee, the master plan, and all of us to really highlight that California is creating and working hard to create a system where we don't have to worry as we get older that we'll be left on our own, as more and more of my family and friends that elected to leave California are finding in those other states. And so I just had to throw that there. Thank you to the entire committee, and a shout out especially to our godfather, Kevin, who really keeps us moving forward, but he's with his family. So I'll turn it over to, I think, Susan. I believe we stayed within the time frame. Thank you all.
Outstanding report and outstanding presentation. And thank you all for sharing in the delivery of that. I was so proud on Friday afternoon to share your report with Richard Figueroa in the governor's office, with Kim McCoy-Wade, with Secretary Galley, with Marco Meach, with Darcy Delgado. And I got a lot of positive feedback immediately. So not just how you designed it, but the brevity and the messaging, the tone, and we'll continue to talk more about this. So we've taken receipt, but this will be an ongoing dialogue. What I really was struck by in your presentation is how I sensed a shift, and it's the same shift that's happening in the governor's office and the administration and at the various agencies is we're moving a rung down. You know, you talked a lot about how this is the impact on communities and on real lives, how we're making a difference. And so we're taking this funnel, this upside down funnel that started at the executive office and the agency level, and we're now really fixing our eyes on how this is helping real Californians and how these initiatives, recommendations, and dollars are flowing to real people that need the services and supports. So we're in it together. We're in sync right now. I hope we remain in sync about making a real impact and a real difference. I really liked how you said, how will I get the care I need at home? Who will care for my needs? How you really personalized things. And as you opened up the focus on two of the big issues. And then to Karen's point, Kim touched on this in the opening, but we did a session with Ethnic Media Services last week where we had 65 reporters who represented the full range of ethnic media outlets, from the smallest to the largest all over our state. And several said to me, I had no idea, they had no idea there were AAAs, area agencies on aging, that they didn't know about a master plan for aging. 2 of them shared that they had relocated their parents abroad back to their home country in recent years after exhausting all of their resources and family caregiving. So we take that challenge about how do we embed equity throughout the master plan. We're going to move to our next presenter, but I know Kim McCoy-Wade, I believe, is still with us. So Kim, is there anything you wanted to say before you drop off? And then we'll move to Jillian Rice.
Very briefly, and you pretty much said it. Thank you, thank you, thank you. But I just, a few quick observations. And Andy, this is not awkward at all. This is exactly how co-creation goes. First, I want to thank you for, as always, lifting up and centering equity. So I want to start with that and continuing to call us to embed equity. A reminder that 2 of the 5 goals have as their targets closing the equity gap in life expectancy and closing the equity gap in self-sufficiency, economic self-sufficiency. So there is more to do to put power behind that. But again, thank you for continuing to lift that up. Second, I think the input to look at systems of care is really aligned with the internal conversations we've been having too. And certainly a system of home and community care choices would be at the top of that list for our communities. So thank you for lifting that up. That's very aligned. More to come with all of us. I would say the third thing I would say is one of the great strengths of this process in this community has been the word and by that I mean we have from the beginning said, and by we I mean all of you have said it's aging and disability. Christina Mills said that, Fernando said that. It's aging and equity. Rigo Saborio, Kevin Pindaville said that. It's aging at older years and at younger years. Jenny Chin Hansen said that, right? Aging isn't just an individual, it's a family experience. Donna Benton, Susan Damaris said that. Aging doesn't happen inside your four walls, it happens in a community. The AARP has said that. So I wanna make sure in maybe for our next phase, moving from 140, that we don't overcorrect and become so focused that we miss some other opportunities that are happening too. So I think about the fact that California is redesigning all of our communities to prepare for the climate future. Infill housing, ADU housing, transit, keeping people alive and safe and sustainable. And we certainly want the aging trend to be part of that conversation and accessibility to be part of that conversation. So it just gives me pause to think about how do we center the crisis of homelessness and also link it to the reimagination of our communities to be affordable, accessible, and sustainable for all. So, but I love the questions. They're the right questions for where we are at this phase. And I really look forward to being in dialogue with you all to get that next phase right and finish this phase strong. So thank you.
Thank you so much, Kim, for being here today too. We appreciate it. So now we will move on to our new colleague, Jillian Rice, who represents RSE, a well-regarded, highly distinguished PR firm based in Sacramento that does fantastic work statewide. Jillian's going to be providing an update to you on the project that they've just joined the department on in support of the MPA. Welcome, Jillian.
Thank you, Susan, and thank you everyone for welcoming me to your committee meeting this afternoon. As Susan said, some of you might be familiar with RSE. Some of you might even know me. I see some familiar faces on here, but just a quick introduction. She mentioned RSE does paid media, public relations. We're a full service agency here in Sacramento for just over 60 years. We do mostly social impact marketing. So we really focus on behavior change and public awareness campaigns rather than, promoting private sales and campaigns, things like that. So you might be familiar with our COVID-19 work, our CalFresh work, our DentaCal work, a number of things there. A little bit about me, and I have a few other team members on the call as well. So my name is Jillian. My pronouns are she and her. As Susan mentioned, I'm an account supervisor, so I will be overseeing this project that we're working with you on, and we will get into the scope and deliverables in a little bit. Just a bit about my background for those of you who don't know me. I've worked for the past decade in communications, marketing, mostly public health policy specifically. So leading campaigns in public, private, nonprofit, with a number of policy ideas and different concerns there. So really excited to work on this important project. Also, I'm joined by Jody Miller, so you'll probably be seeing her and hearing from her as well in the future, as well as Paul McClure. So a bit about what we've come on board to do with CDA. So we're really looking at developing some brand communications for the master plan. So we're going to be, auditing the existing materials, the channels that we're using, looking at messaging on the assets that we're using. We're going to be also, working on media relations work, pitching stories, reaching out to media, developing press releases, all of those activities. and then as well as helping support the partnership outreach. So looking at what is that stakeholder outreach, what are the events that we're holding, how can we promote those input mechanisms? So really the overall goal, we want to increase awareness of and also participation in the master plan. So, I think you guys did a great setup for this, just before this, in terms of we want to tell the MPA the story of it in a more human way, in a more accessible way. We want to look at how we can uplift local stories that really show the impact and the value of these initiatives. And then also looking at when we gather input, who are we gathering it from? How are we gathering it? So some of the key audiences here that we're looking at, obviously there's stakeholders, and that could mean a variety of things. I think one of the great things about the MPA is there's already been a lot of, kind of traditional stakeholder buy-in between government agencies and advocates, and obviously the governor, but also looking at the public's awareness, other legislators and elected officials, and philanthropy as well. So as Susan mentioned, we're looking at, a funnel approach as well. So how do we build awareness? For this, we're not conducting paid media, but mostly earned media, but really looking at how can we get the word of the MPA out just generally, so most people have heard of it. Then how can we engage folks? There's a lot of powerful organizations, even on this call. How can we utilize those networks that are already at the table to spread the word? And then how can we directly connect with individuals and actually move them to action? So, kind of moving from awareness to buy-in to action. So, we've just dived into the work. We've been identifying what we see as, challenges and opportunities there. And, as I mentioned, you guys have mentioned a lot of them on this call. So I think that, there's a lot of agreement there, which is good to see. I think, coordinating between the people that are already at the table, as I mentioned, how do we utilize these networks to further spread that information? I think another issue is the number of initiatives. While it gives us a breadth of areas that we touch, it's very hard to tie all of them to the MPA. There's probably some competing brands and things there in terms of the initiative name and the MPA and how you communicate that. And then the idea of equity being throughout. So, that's also in the communications. It's also in how we talk about it, who we're talking to, and what the delivery mechanisms are there. So I think overall awareness of, the MPA itself is going to be huge. Part of that's going to be, we need some more digestible key messages. We need an elevator pitch, so to speak. And we need those humanizing, real lived experience stories of why this is important. Other than that, I think there's a lot of different calls to action. So, we want people to get input. We want them to attend events. We want them to, support different budget initiatives. So I think that we need to be clear for each of these audiences that once we tell them what the MPA is, exactly how we want them to engage with it and what the expectation is there. So some of the other things we've looked at in terms of, maybe areas of opportunity that we can improve upon is looking at the website. There's multiple different places people can go for information, looking at the collateral that we have. Again, we have some lengthy reports, which are great for stakeholders who really want to dive in, but for the public, I think we need some shorter, social media posts, small one-pagers, things like that. And then I think, most of the communications has been in English. So we need to look at how do we adapt that for other languages and other communities to make sure that it's resonating with them as well. And then also the input mechanisms we're using. Are webinars the best way? Our online surveys? How has the engagement with the roundtables been? Things like that we can also give some consultation on. So I mean, there's a lot of items that we've already talked about today. The next step as we go into building our communications plan, we'll look at how we want to address this and tactics we want to use. Got some great feedback today. If you have additional thoughts on some other challenges that we didn't bring up, or some ideas around how you would like to see, this plan develop, would love to hear from you. Feel free to contact me directly. Otherwise, I think the main, ask today is that when we come back with this plan, there'll definitely be some implementation that we'd love to see you guys join us on. And so we'll definitely be returning to this group and hopefully utilizing, all of your channels to reach folks as well.
Great. Thank you so much, Jillian. And do you have a few minutes for a couple of questions, or do you need to? Okay, great. Are there any questions from anyone on the Impact Committee for Jillian while she's with us? I am not seeing any raised hands.
Fernando?
Oh, yeah, thank you for this and for this. I hope you can hear me. Thank you for this and for this comprehensive approach to messaging and getting our work out. But could you answer again? You kind of addressed it. How do we reach those that are not aware of our work and or the benefits, the impact we're having with our master plan on aging? How do you get to somebody in Fresno, California, has no clue what we're doing or why it matters that we prepare this state to be age friendly for them, even though they're not thinking that far ahead?
Absolutely. I love that you picked the Central Valley. I'm from there. So I think, there's a few things that we want to do and that we're definitely going to include in the plan. I think when you're looking at this kind of systems change, you really need a surround sound effect. You need multiple places that they're hearing it. So we would like to get more media coverage in the variety of different outlets and a variety of different placements as well. That talk about the MPA, maybe uplift the local example, talk about it, how they can engage in a local playbook, build some momentum there. Also looking at who are the trusted messengers in their community, whether that's those organizations that are on this call, if there's some that aren't part of the, coalition that we need to bring in, who can be a good spokesperson there. We're also looking at elected officials, how can they communicate with their constituents, ways that they're supporting this, and if they need support from them as well, for if they're sponsoring or champion any budget or legislative moves. And then I think, we're looking at what are those different avenues as well. So is social media, is a huge area that I think we can have a lot of traction, and hopefully it will start with organizations, and then it can transfer to an individual level as well.
And a related question: how might you make use of us, members of the Impact Committee, members of the Master Plan on Aging, their various committees and subcommittees? How can you exploit us for the greater good?
Definitely. So we're looking at developing a lot of kind of plug and play content that you guys can send out. So if you have a newsletter of your own, rather than, just coming to the newsletter that the MPA is putting out, your actual newsletter you can give to people. So we'll give you, content like that, social media posts, any other, collateral that might be necessary. If you have ideas around that, would love to hear that. And, we can work with CDA to develop some items there.
Well, I'll push back, and I promise my last comment, I'm going to push back. I'm thinking about how we can also be upfront with you as ambassadors, spokespersons, because all of us on this group have lots of free time on our hand, and we're always looking for doing more things. I'm kidding on that part. But, we've got amazing talents with this group and with the larger group, and I would think you would want them front and center, whether it's speaking at a group or their stories being presented or they're speaking on behalf of. So I'll stop with that.
Definitely. We'll definitely need a lot of spokespeople when we start engaging with media who are confident in, conducting interviews or have those stories to share. So that's definitely an area that comes top to mind. If there's other areas that, you have in mind to volunteer for, definitely let me know and we can talk about how to work something else in as well.
Great. Any other thoughts for Jillian, who's still in the first month of engagement on this project? So yeah, about 6 weeks in. So we're just getting started and just so happy to be working with RSE. Any other thoughts or comments? Jillian did leave her contact information in the chat.
Thank you.
And thanks to your team also for joining with you, Jillian. All right. So we'll now move to our next. This is actually part of our stakeholder engagement and relates a bit to what we just heard. And the idea emanated from this group, I believe. It started with Andy Imperato, who suggested that we have, well, first of all, let's see who has been to an in-person conference in the last 6 weeks or 2 months. Anybody on this? Okay, Sarita, Amanda, I know ASA, Andy. It feels really good. It feels really good to be with our people again. So we are hopeful that by September 20th, there will be an opportunity to gather in person in Sacramento and to convene a la the White House Conference on Aging as the impetus for this, but our state is big enough that we can do our own, take this to scale. So Andy made this suggestion and we've had some conversations, and we are incredibly grateful to the SCAN Foundation and the 6 other philanthropic partners who support the master plan work. We meet monthly with the philanthropic partners, and we surfaced this idea about 2 months ago, and they embraced it wholeheartedly as all 7 funders to see if we might be able to convene all of the leaders in the aging and disability and caregiving communities. This goes to your report where you talk about the coordination among the stakeholder committees. There will be an opportunity for all of the committees to do some pre-work and present their platforms and to meet as a group. It may be the very first time that many of our stakeholder committees actually meet together in person. So we're very excited about this. We've had approval from the governor's office and the agency to proceed with planning, and we'll be working closely with you on the design of the program and ways to engage meaningfully with templates that we can start working with the stakeholder committees now so that they can use their meetings between now and September 20th to build out their platforms. And your report that we just received is a great frame, to be able to share that you've identified these 2 areas of focus, and we'll be able to provide some general guidance without restricting ingenuity and creativity. So I'd love to turn it over now to Sarita, who's been key since day one, to talk a little bit more from the foundation perspective.
Yeah, thank you so much, Susan. Yeah, and I'm thrilled with this prospect of having an in-person event, and kudos to Andy for spearheading the conversation and making this important suggestion. So I am personally very pleased to share that that the California Department of Aging asked the SCAN Foundation to see if we would utilize our normally scheduled annual fall forum event to do a 2022 a conference on aging. I think the title to be determined. And I think this is going to be fantastic because this conference will serve as, Susan has already highlighted, as the kind of in-person leadership engagement, working groups, gathering everybody at all of the MPA associated groups, all the committees we talked about earlier, and, I think really talking about how you think about alignment and goals across those committees. To really help, I think, develop and outline those CDA initiatives and deliverables over the next 3 to 4 years. So we're delighted to repurpose our forum event to make this happen, and for the state partners and assist with logistics in any way we can. As Susan mentioned, very important, this is being jointly funded by all the MPA Foundation partners. They're supporting this kind of state-led event, and we'll have equal kind of co-investment, co-branding in the event. So this is not just a SCAN Foundation sponsored. I want to definitely highlight that. And again, just I think meetings are going to be underway, as Susan mentioned, to really develop the meeting design and the agenda. So I'm really excited. I'm excited to help and support in any way. And Susan, thank you to you and your team for their leadership on moving this forward.
Absolutely. And we also will invite, of course, the governor will be invited, the first partner will be invited, cabinet members will be invited, our federal partners will be invited. We can't commit anybody at this point, but we will look, we will cast the net widely to make sure that there's a good two-way conversation so that those leaders get to see us at work and we get to influence those leaders as well. So more to come on that. Any initial feedback, questions on this unfolding convening? Sarah.
Susan, I have a request for everybody. Put on your creative thinking hats. We would love your feedback on a name for the conference that weaves in aging and disability with an equity theme. So yeah, just think through that.
And I'm looking to see if anyone has their hand raised. Great. Oh, Andy, please.
Yeah, well, first, thank you, Susan, for running with this idea, and thank you to the funders for liking the idea. Part of my goal was to just get the folks who work together on the master plan to have an opportunity to come together in person, because we really didn't have that opportunity for most of our time and for all of my time on the advisory committee. But one thing I just want us to think about is our federal partners, and I know you're thinking about this, Susan, but we have a huge congressional delegation in California, so there may be an opportunity as we look at key committees that our members of Congress are on to not just limit ourselves to state officials, but also think about maybe getting some key feds, either members of Congress or members of the Biden administration or both, to come and be part of the convening and thinking about how the federal government can be a strong partner for California around some of these themes.
Great, and we'll lean into people like you who've worked in Washington and others to make some of those connections for us. But absolutely, we hope to have Region 9 of CMS and Administration on Community Living represented, and members of the California Congressional Delegation. And looking at September 20th, one of the advantages is, it's well, at least at the state side, it's after we will know where things stand with the budget. We will know where most legislation stands. So it's a really good jumping off point for the next round of initiatives. And it's also not too late that we hope we can be influential with next January's budget. So not seeing any other hands raised or comments. You'll all be involved starting now, so more to come on that. At this point, I wanted to turn it over to Sarah Steenhausen, who, Sarah, you were with us at the last meeting of the Impact Committee in your role, is that right?
It was my first day.
Your first day, that's right. Well, she's come so far, so fast. I'm so happy to bring Sarah back and to share with you, because of your oversight role as the Impact Committee, Sarah's going to provide a high-level overview of where her division is headed. So take it away, Sarah.
Great. Thank you so much, Susan. It's an honor to be here with all of you today. I just wanted to give you a brief update on as Susan said, some of our emerging initiatives and where we are in building out the work of the Division of Aging Policy Research and Equity, because it's so critical to the master plan. So I wanted to just start by giving an overview of this division, and its key objective is advancing the policy, the research, and equity in alignment with the master plan for aging. And we want to do this by applying an equity lens that elevates older adults, people with disabilities, and caregivers across program, policy, and research efforts. What's important about the work of this division is it's not limited to just the CDA programs internally. Of course, they are certainly a key part of it. However, what is so exciting is we have the opportunity, really our success is in how we work with other partners across the state, within Cal HHS and other state agencies as well as the stakeholders. And stakeholder engagement is such a key component of all of this through the Impact Committee and the several others associated with the MPA. And also our key partners being the real people. So how to, as we've discussed today, how to assess the impact that system change is having on the people that it's intended to. And that's really supposed to, really focusing on rooting our efforts in equity. So if you want to turn to the next slide, the way that our team is being built out, right now it's a team of 3. It's myself and Amanda and Norbert for the MPA team. But what's really exciting is that we are about to start building out 4 other teams in this division. First, our workforce team, which is focused on leading efforts in the department to on the home and community-based services spending plan to utilize some of the workforce dollars to develop training and stipends for the home and community-based services workforce in partnership with our other state partners. We're going to be building out a policy team with a policy lead and some policy analysts to move forward on the range of issues that impact the master plan issues. We're going to be looking at developing a research team, and in the near future, we'll be recruiting for a research data manager to lead the efforts in partnership with the rest of the DAPRI team. And then finally, and very importantly, we're so excited to be building out an equity team with a chief equity officer and a tribal liaison. And we hope to start recruiting for that position within a month or so. So all of this together, I think, it's a key focus right now is building out our team. I think that our next hire will be the workforce lead, and we're really excited about that. So hopefully certainly by the next Impact Advisory Committee meeting, you will be able to meet that individual. So if you want to turn to the next slide, I wanted to give you an update on a recent effort that was launched that's in alignment with a goal, an initiative in the master plan to launch an aging and disability research partnership with academia, state level leaders, as well as philanthropy. And we're super proud that we had our first convening 2 weeks ago. And if you want to go to the next slide, tell you a bit about the focus of this research partnership. I think that why this is so important is we're trying to give policy to be rooted in research. And at the same time, we're trying to have research be rooted in sound policy so that we don't have a disconnect between data and the actual experience of the people who are utilizing the programs and services. So this is an effort to advance age, disability, and equity-focused research in line with the master plan on aging. We're looking to our partners to advise on the key performance indicators for the data dashboard for aging. As you all know, that's something that we're super proud of, but we know that it's just beginning and we have a lot of work to continue building it out and to particularly focus on equity and gathering the data and the indicators we need to assess our progress in implementing the master plan, but also to assess where we have gaps and where we need to build out further data. And we really think that this could, if you could go back, please, model an equity-focused research partnership that is really one of the first of its kind between academia, philanthropy, and the state, and can serve as a model for other state entities as well as nationally. So we're really excited about that and look forward. I think the important thing was that the work of this partnership will really engage with all of the stakeholder advisory committees and particularly equity, ensuring that the equity advisory committee is playing a key role in helping advising on data and research needs that are rooted in equity. So that's my update, and I'm happy to take any questions.
Thank you, Sarah. Looking for questions here. Anybody with their hand raised want to comment? Not seeing any. Okay, in case I miss you, sometimes the logos look like all good. Nope. All right, Sarah, thank you for joining us, and we do look forward to meeting your new staff at the next meeting. So on this slide, we're going to hear a bit from Amanda as our stakeholder engagement continues. Amanda, you want to walk us through the Webinar Wednesday series?
Sure. We just wanted to remind everyone and get on your radar that we are focused on addressing a lot of these key issues in the master plan for aging throughout the rest of this year, those areas that we focused on in the initial initiatives. And we did have that March 9th webinar on CalAIM community supports. I think it was our highest registered event we've ever had. So there was a lot of interest in that topic of leveraging aging and disability partnerships, you know, on the ground. Over the next few months, we are going to focus on advancing age-friendly health systems. That is our next webinar. We also will focus on Alzheimer's and dementia in June for that month, uplifting community engagement and volunteerism. We also want to have a focus on data and equity, so continuing to build on what Sarah just spoke about. Climate change and emergency preparedness. We really want to start to bring that topic up, bubble that one up and have that play more of a role in some of our committees as well. And so we'll be having a webinar specifically focused on climate change and emergency preparedness. Also, best practices in disability awareness and employment. We're doing a lot of work at the state to help improve how we actually do our outreach and engagement to improve our employment processes. So we'll have some subject matter experts on that panel joining us. And then in November, we'll focus on caregiving, family and friend caregiving. And then we'll wrap it all up at the end of the year, really with what the first 2 years of the success of the MPA has looked like. What are the policy, budget, and program? What's the progress on those 3 topics? So I hope you all are able to attend these. I will keep sending everyone emails specific with the registration links and the info. And of course, I do want to plug that, is it next week? No, 2 weeks now, that May 4th, Advancing Age Friendly. We're going to have Zia, you all know Zia Aga, I believe, as well as Dr. Laura Mosqueda joining us, and a couple of other experts on that panel. We've been making these really interactive with a number of panelists who really share best practices, and we have Q&A time. So we're revisiting that Webinar Wednesday series, but really trying to build on it and make it a lot more interactive, and it'll also feed into, you know, next year's 2, 3, 4 years of priorities in the master plan. All right, I'm going to pass it back to Susan.
Okay, thank you. Well, I see Professor Fernando Torres Gill is off to a 3:30 class, it looks like. Thank you, Fernando, for leading us today. Bye-bye. And thank you for all the comments in the chat, good suggestions for naming for the summit. We'll take those under advisement and just send us any other thoughts you have via email. And we'll be meeting with the first preliminary meeting is this Friday, I believe, to start mapping out the structure. Andy, yes.
Yeah, just, you know, one thought that I had for the summit to think about when you think about kind of who might get invited to it and different sectors that you might want to have represented. I think it might be interesting to think about kind of storytellers who can help people kind of learn about aging through the media, through, you know, the entertainment industry and other forms of storytelling. So that's just a discipline that we don't always have at the table, but I feel like California tells stories about aging for the whole world, and thinking about who's telling those stories and what are the messages, and is there an opportunity for us to engage that sector within California in the years to come. And the other sector that I think is worth thinking about is the tech sector, and, you know, the innovation that goes on there. There's a whole group of folks in the tech industry that are focused on human-centered design and accessibility. And I think getting them thinking hard about how to leverage technology to help people live independently, those two kind of groups of people would add value, I think, to the summit, but they weren't necessarily heavily engaged in our stakeholder process for developing the plan. So I just put that out there.
Great suggestions. Thank you. All right. Anyone else with their hands up? Okay. So my closing thought before we open it to public comment, I just want to, thank you all so much. Each of you are leaders in your own right, and I know you have your own organizations that are going through change right now, returning to work and hybrid work and remote work. I know it's a very busy season legislatively and with the budget. I know many of you have been impacted with new dollars too, that you're, moving through your organization. And I know you have stepped up to help with communication around vaccines. So looking at all of you, it's not just the impact committee that you're leading on, you're leading in your organizations, communities, and nationally. So we appreciate so much the time you give to this group, the thoughtfulness that you put into the report, the time it took to prepare that, so that we can keep the momentum going. And I know you have a plan to disseminate that yourselves and widely. We appreciate that so much. And that's really a message that as we move forward with you sort of at the helm of all of the stakeholder groups, really looking at how all of our stakeholder groups can be more engaged thought partners with us. And we're really examining how these meetings function in terms of, we can always bring in experts and we can do lots of PowerPoints and have slides, and but the people that are assembled around all of these tables have so much expertise and wisdom and connections to their communities that we want to hear more from the stakeholders than they hear from us. So we will be looking at how we can do that more effectively. We welcome your thoughts. This is a little laboratory for doing that. Today was a great example where, if we did a ratio, we want to have more impact committee members speaking than state officials in these meetings going forward. So I think we did that thanks to your great pre-work. So thank you for your continued support and leadership during our time together, and also not our time together. We know that you're all champions for the master plan and the recommendations and initiatives. And I put in the chat, we so appreciated the op-ed that Nancy and Sarita did a month or so ago. That was most appreciated. And we hope to have more opportunities like that where we can support you in doing activities like that. So just thank you. We're enormously grateful for you and your time. We have two questions in the Q&A there, but we will open it now, Maria, if we can, to public comment. Thank you. I'll let you take it from here.
Thanks, Susan. Yeah, it looks like we have a couple of comments in the Q&A. I think Jillian Rice had to hop off. These are really focused on communications, and there's some suggestions there. So the first comment is from Liz, who is asking, how do we get the information about the master plan to seniors and those with disabilities? How do we find what their experiences are, as older adults and people with disabilities don't usually trust unknown entities? And the second comment is from Carol Schwartzlander, who recommends looking at the databases and outreach strategies of various California census efforts, Complete Count campaign. Since 1999, the California Commission, maybe that's not California Commission, CCC, used innovative methods to conduct outreach and to engage underrepresented and hard to reach communities, including ethnic communities, homeless communities, etc. They not only used trusted CBO messengers, but also worked through schools, including K through 12, to conduct outreach. And she shared a link to the census there. And I do see one hand up, Liz. I don't know if your comment was already addressed, but we'll open your line in case you have some additional information to share. Give you a second to unmute yourself if you'd like to jump in. Okay. All right, anybody else have questions or comments? Feel free to raise your hand or use that Q&A feature and we'll read your comments or questions aloud. If you're joining us by phone, you can press *9 and that'll add you to the queue. Okay, seeing none. Susan, I'm going to pass it back to you.
All right. Well, thank you to our 2 ASL interpreters who covered today's meeting. Maria, thank you for all of your support to make this possible and to make it happen and run so smoothly. And to the CDA team who's joining us. I appreciate everyone's contributions, and we will go ahead. This is unheard of to finish early, but we'll be back to you probably in about a month to talk about next steps on that September 20th conference and to ask for your approval of a template that we'll be using for each of the stakeholder committees that you'll help us design. So thank you, everyone, and have a great rest of your day. Bye-bye.